You've just had an abnormal coronary artery calcium test. And trust me, I know your first reaction is going to be, oh, shucks.
Sugar pops.
Sugar pops,
Sugar
yeah.
pops.
But the bigger question you can then ask yourself is, okay, what next? Now what? And Dr. Lacey and I really just want to walk you through kind of a roadmap as the questions we get asked all the time about what to do when your arteries have calcium in them. Today on Living Heart Smart.
Thanks for listening again to Living Heart Smart. Matt, we're talking about when you have an abnormal calcium score. And there are really a number of questions that we get asked over and over. Yeah.
Well, people get concerned right away when they think something's new is going on with the heart, because this test really opens people's eyes. And then a series of questions then starts popping up, and we'll help guide you through those.
And it can be really scary if you open up your result and there's a number that you weren't expecting to see, and it can be really frightening and life-changing for people. So let's help you understand what the tests are, what the score shows. So there's a number of questions that we get asked. We get asked questions about, what does this test score even mean? I get asked a lot, can't you just fix it?
Yeah, that's a big one. Just fix me, right?
Just fix me. A lot of people want to know, and we spend a lot of time talking to people about what can they do to really help themselves. Yeah. And then what medications are needed. That question is hidden in the, do I really need medications?
Yeah.
We'll talk
both
about
sides
that.
of that coin, right?
We'll talk about that answer. And then finally, what about my age? Isn't this normal for my age? Does my age matter? And so those are the biggest questions I think that we get asked.
Right. Yeah,
Let's
that's true.
try to dive into them a little bit.
Sure.
Yeah.
Okay. And the first one is, what does the test mean? I love this test. This is the only non-invasive way we can look inside the heart arteries to see if there's any early cholesterol and calcium building up.
Completely agree.
It's non-invasive. There's no IV. There's no prep. You just lay there. The test gives you it's a quick CAT scan, low risk study, and it gives you valuable information about your arteries. And what I really like about it, Carolyn, is that it really turns this kind of theoretical, like, oh, am I at risk for heart disease? You know, I've got some family history of heart disease. What does that mean? I've got an elevated cholesterol. What does it mean for me? So we've taken those theoretical concerns, which are real concerns, but now we've turned it into a diagnosis. And just because you now have a diagnosis of atherosclerosis or arteriosclerosis doesn't mean that you're doomed to have events or problems. It means now we've turned that into a disease that we know what it is, we know how to treat it, and the treatments really work. So
they do.
I kind of look at it as a good sign, like, hey, now you know what's happening with your body. Now you can attack it straight on. So that's the key for me about why this test, I think, is so important.
I agree. I think this is a great test. Why don't we talk about the numbers? Why don't we talk about the actual scores? Oh, okay. What do you want to say?
Oh, let me just say one more thing.
Okay.
I've never seen a test result be more motivating either. It's just so motivating for people who understand they want to be proactive now to have a number or a score that they can really deal with. And so I've seen it be really helpful for people making changes.
Me too.
Okay, good.
Okay, why don't we talk about what the scores are? How do you talk to patients about the scores?
I break it down into either low, medium, or higher risk score. Mm-hmm. Now, higher risk doesn't mean like events around the corner, but that's the way the test scores are broken down. And a lower risk score is a score that's less than 100. So we'll call it abnormal if it's anywhere between 1 and 99 or 100. And what does that mean? That means there is a risk of some sort of event. You've got about a 5 to 10% risk over the next 10 years. So the risk is over long term. That's the way we look at cardiovascular risk. Right. So that's a low risk study. A moderate risk study is a score between 100 and 400, and then a higher risk score is above 400. And we see all of those scores all over the maps. 0 is normal.
0.
No matter what your age, 0 is normal. But there is some context in that based on your age, what the scores really mean. And we'll talk about that, I think, a little bit later in the show.
And Matt, sometimes we see scores that are really high. I've seen scores in the thousands.
Mm-hmm.
I think 3,000 is probably one of the highest scores I've ever seen.
Yeah, I'd say 3,000 is easily commonly in people that look healthy, that feel fine, and it's a surprise. And so it's really good to know
really
what's happening with your arteries. So it can be jarring and motivating.
And I like how you pointed out that a normal score is 0. Yeah. So we've talked about normal is 0 and abnormal is anything that's not zero. Right.
Yeah, you shouldn't have any calcium in your arteries. Calcium is only gone where there's cholesterol building up. And this process, by the way, takes decades. This didn't happen over the last 2 years when you went off your diet a little bit. So the process is a long-term process. 0 is normal for everyone. Now, it's not the average that you may get in a 50 or 60-year-old person in this country, but 0 is the only normal number. Okay, so that's what the scores mean, low, medium, and higher risk. But that's probably not the first question, Carolyn, that you and I get when a person comes in to talk about their calcium test. The first question, can't you just fix me, or why don't you just fix me? That's the biggest thing. It's like, my arteries have stuff in them. Go fix it.
Take the Roto-Rooter. Can't you Roto-Rooter that out?
Yeah, that's the biggest thing.
We get asked that a lot.
It doesn't work that way now, and it probably will never be working that way in the future either. We don't just fix arteries because there's cholesterol in them.
And Matt, when people are asking about fixing arteries, I mean, they will say Roto-Rooter, but they're really talking, people are really concerned, does this mean that I need a heart catheterization, an angiogram? Do I need a stent? How do we make this better? Just the presence of the calcium makes people think, oh, this isn't normal, we need to fix it. And we really don't do that. This is, I kind of think about calcium in your arteries. This is damage that's already been done to your arteries. What I've heard in my conversations with people is that they think that doing an angiogram, putting something in the artery, that's going to be enough to stop the process and prevent it from getting any worse. And the unfortunate reality is that's not the case. We want to try to fix people, if you will, people. Really, we're trying to fix symptoms if they're present. So that's where I usually start when I talk to patients. Yeah,
I think the fix is whenever we talk about balloons, stents, angioplasties, bypass surgery, roto-rooters, we're really talking about fixing symptoms. That's the indication from a cardiology standpoint. We don't fix arteries that have moderate blockages in them because it's there. We do procedures on those to prevent and help and reduce symptoms like chest pain, pressure, tightness, heaviness, those kind of things. So that's a different story altogether. Just because you have cholesterol in the arteries doesn't mean that you need a fix mechanically. You do need a fix with medications and diet and exercise and all the lifestyle changes we'll talk about. So those are two different pathways, and they're completely different.
And honestly, I think when people come in and they say, can't you just fix it? It doesn't matter what the person's score is. If the score is low, people are reassured. But even when the score is really, really high, like we talked about, sometimes over 400, sometimes over 1,000, I still get asked, okay, can't we just fix it?
We don't have to rush
to be right there just yet. Our treatment is still the same.
Yeah, that's right.
Right.
Well, we'll get into a little bit. I think one of the questions we're going to answer is what other procedures should I be considering? That's a different question, but just fix me typically isn't going to be something we're doing for most people that have an abnormal coronary calcium test.
Right.
Yeah, so if you have an abnormal score, my particular approach to patients, if your calcium score is above 400, that typically will trigger a stress test, even if you have no symptoms. Now, if you have symptoms, again, we're going in a different path possibly.
Right.
But with average person gets the calcium test done, they've got a score of 400, 500 plus, then for me, that triggers doing a stress test. A stress test, what that does is making sure there's no major blockages in the arteries. So if you have 70, 80, 90% blocked artery, that will show up on a stress test, and that may be an indication that we then proceed with a procedure like a heart catheterization or an angiogram, balloon, possibly stenting. So the big two indications to start fixing arteries mechanically would be symptoms of chest pain with exertion, for example, or a really abnormal stress test to suggest some heart may be at risk. The other question I get about testing-wise is there's a little bit more of an advanced type of non-invasive CAT scan called a coronary CT angiogram, CCTA we call it. And that does involve an IV and some medications to slow your heart rate down. It does look at the hard plaque, which we've identified on the calcium test, but it also helps look at the soft plaque. And people ask me about this test, and typically I do not recommend it because once I have a good picture of what the arteries are doing as far as how much calcium is in there, I really don't get that much more information from how much soft plaque is in there because I know wherever there's hard plaque, there's going to be soft plaque that test didn't see. that we're going to be treating with medications and lifestyle.
I agree. I typically don't do a CT coronary angiogram just to look at the arteries, because I want to know if we're already doing a stress test, and if it looks on the stress test that your arteries are functioning okay, that they're functioning normally, and you're not having any symptoms, again, that CT, that doesn't add anything for me at all.
No.
That doesn't change anything anyway how I'm going to treat you.
Right. I think the calcium score has identified that you have this process going on. It's helped us identify what your LDL target's going to be when we talk about cholesterol treatment. And adding a little more data, that doesn't change anything.
So we've identified the score. We've talked about the mechanical. How do you just fix it? And now let's get into what are we really going to do? When I see that score come back, it makes me think, okay, now what?
Yeah,
where do we go
let's
from
set
there?
up the plan.
Let's set up
to
the
keep
plan.
your heart healthy
Right.
and to try to prevent this plaque from progressing. That's where we are. That's what we want to do. Fortunately, we have a number of good ways to do this.
The first thing I always like to talk to patients about is like a broken record, right?
Yeah.
Nutrition, exercise, don't smoke. Those things, they get poo-pooed in, a little bit, and people think, oh, yeah. But they help so much. It makes such a difference in how your arteries are functioning, how you feel if you are working on having really good, healthy nutrition. And we've talked about the Mediterranean style diet. We have an episode about the Mediterranean style diet that you can learn more about it. And then working on increasing activity. And so if you've not been increasing activity and you have this score come back, and we've talked about it and you've decided with your doctor, okay, it's okay for you to exercise, it's really important for exercise.
Yeah, Carolyn, I think you're exactly right. I mean, so these changes that every single person that we're talking to today can make, we call them therapeutic lifestyle changes, Mediterranean style diet, 150 minutes a week, good sleep, less stress, get your weight under control, all of those things. Every single one of them makes a huge difference. And if you piece them together one by one and then add some medications that we're going to be talking about, that's the roadmap to success to handle anything that's going on with your arteries.
We've talked about those other things that you can do, but there are other parameters that you can monitor, right? So check your blood pressure. Know your blood pressure. Your blood pressure optimally is less than 120/80. If you have diabetes, you want to be working with your doctors to get your diabetes under control, to get that glucose under control, get it lower. That helps your arteries as well. And then when it comes to your cholesterol, this is the other part. We have to talk about your cholesterol. You want to know, what's your LDL? It's important for you to know, especially after you have an abnormal calcium score. And you also want to try to look into getting an LP(a) tested if you haven't done that before. We have an episode about LP(a) too.
Carolyn, you mentioned LDL, which is bad cholesterol, and lipoprotein(a). I will comment real quick on that. All of you for sure should know what your lipoprotein(a) is. It's a genetic type of bad cholesterol. Please ask your doctor to screen for it. You're supposed to get it at least one time, and because treatments are coming. So the general answer to the question is, do I need medications now that I have a positive calcium test, is yes. Because whatever you're doing, whatever your number is, it's too high. There's cholesterol and calcium inside your arteries. So in order to stabilize that and lower your risk, medications do help. And the calcium test is great because it kind of gives us a guideline. It says LDL should be less than 70 or 55 would be the guidelines depending on what your score is and your age. But it gives us a number. It tells us the arteries need medication to help stabilize that plaque, and it works. So in general, the answer is yes, you need medications, along with all the good stuff you're going to be doing at home.
Right. Episode 26.
Oh.
Statins. That's our episode on statins.
Oh, good. Yeah. Oh, that was a good one. Yeah.
Yeah.
I like that one.
Matt, you know what other medication that I end up talking to patients about when it comes to
I do.
cholesterol?
Let me guess. Well, let me guess.
Really?
There's one other big one that comes to mind
in
my mind. Let's talk about aspirin. Yes, please.
That's right, aspirin. Everybody's asking about aspirin. Now, do I need it? Do I not need it? I use this test to help me decide, okay, I do need it.
Yeah.
Or maybe I don't.
I will say, in general, we used to give it to everybody when they had 55 or 60 or whatever age. You're like, oh, this is preventive. It's all good. We do, of course, know there's some trade-off there with small bleeding risk. Now you need to have a good reason to take an aspirin a day. And cholesterol and calcium in the arteries is one of those good reasons. Yes.
Right. And so our guidelines are recommending if you have a coronary calcium score that's greater than 100, it's probably reasonable to be taking aspirin. And that's where I usually start recommending it to patients.
Yeah, me too. I think that's where the benefits of
being on aspirin in addition to the other things.
Right.
What are you doing?
I don't know. I was going to go benefits risk. It's always about benefits and risk, right?
It's always about risk and benefits.
I think once your calcium score is above a certain level, the benefits of you taking outweigh the small risk of some bleeding and irritation of the GI system. So perfect. It's another great reason that we put all this together, and we can lower the heck out of your risk once we know what's going on with the arteries. Combination of the lifestyle changes, the statins or cholesterol-lowering medications, and a baby aspirin go a long way. They really work. That's the beauty of this whole thing. Yeah.
I think this brings us back to, but isn't this normal for my age?
Isn't
it normal for my age?
Yes. I think it's very important to clarify the term. I would say average for my age versus normal for my age, because normal is zero, no matter what your age. That said, yes, if you're 60, 65, 70 years old, and you have calcium in your arteries, their average person in this country does have some cholesterol and calcium score that is positive. So you may be average, but that doesn't make it normal, nor do you really want to be an average person with calcium and cholesterol in the arteries.
Okay.
But Carolyn, I think it does require a lot of thought, because it's really a markedly different test depending on what age you have the test done. So if you're 40 and you have a small amount of cholesterol and calcium in the arteries, let's say your score is 50, that's one thing. That's very abnormal. It would be very high compared to the average person your age having the test done. But if you're 75 and have the test done and your score is 40 or 50, that's actually pretty darn good, and you'd probably be well below average, and we may not be as aggressive in treating your cholesterol and other things. So age matters, but normal is normal, and normal is zero.
I agree with that. Let's come back to the beginning. You've had a calcium score, and you've seen your results.
Yeah.
And the score's kind of a game changer for you, because it's not what you were expecting to see. And it's frightening, right?
Well, I think what the key, once you see that score, is let it be motivating. You move toward a heart-healthy lifestyle. And take this information and use it to change your trajectory, and just kind of make those changes that you need to make to keep moving forward. And it's nuanced to work with your doctor on exactly which medications you may need and which testing you may or may not need. I think that's the way to really look at this test, is using it as a tool to change your trajectory to make your health better for the long term.
I like that. We want to be as healthy as we can for as long as we can.
Right.
We can still do that even with an abnormal calcium scan.
That's exactly right.
So a little pep talk if you're really feeling really overwhelmed after looking at your result.
Yep.
Just start taking one small step. That step can be filling that prescription that you didn't want to fill before, getting it filled, and just start taking that prescription to help lower your cholesterol. Or go for a 20-minute walk, or change out a meal that you know isn't really the healthiest option for you. Do something to make it more plant-based and healthier for you. And as you start accumulating these small good habits, they're really going to make big changes for you as time goes on.
Yeah, I like that advice. Great.
Yeah. Thanks for listening to us today. We love getting your feedback. We want to know what episodes you want us to talk about. We're happy to do that. And we hope that this helps make your score a little less frightening.
Yeah.
Thanks for listening to Living Heart Smart.